Morning, students. Today we are going to discuss about Unit 10, Unit 11, and as well Unit 12. So yesterday we have completed up to 9 units. Okay. So today's is a 10th unit. That is a patient-practitioner communication. So the unit objectives covers understanding nature, importance, and impact of communication in health, outcomes, and adherence. Am I audible? So the cornerstones of effective healthcare is a relationship between the patient and the practitioner, a bond built on trust and the clear exchange of information. It is vital to recognize that even the most technically correct medical advice can fail if the communication is fault. If, for example, a simple instruction like take this pill twice a day after meals. So can lead to a significant confusion to the patients. A patient might wonder if breakfast counts as a meal or if they can still have milk in their tea if the label warns against dairy. So beyond simple instructions, the practitioner personal style, their warmth, sensitivity, and willingness to evolve, the patient is planning, heavily influenced whether a person continues their treatment when a practitioner is hurried or talks down to the patient. So it can be lead to breakdown in the relationships, causing the patient to procrastinate or stop seeking care together. Conversely, when the practitioner spends time providing appropriate information and matches the patient desired level of participation, the likelihood of treatment success increases. Ultimately, this that health outcomes are determined not just by the pills described, but by the quality of the conversation that occurs within the clinical settings. So the information exchange and the knowledge gap. At the core of the patient practitioner interaction is a transmission of information, a process that is frequently susceptible to error. The doctor might explain a concept poorly. The patient may misinterpret the words used, or the patient might simply misremember the instructions later. This creates a significant knowledge gap whether doctor and patient essentially speak different languages. For instance, practitioners often overestimate how much a patient understands or remain insensitive to the ambiguity in their own advice. A classic example is a study showing that patients often take drugs at a wrong time because they misunderstand the printed instructions provided on pills back. So the role of compatibility and participation. The quality of the relationship depends heavily on the compatibility between the patient desires and the practitioner's delivery style. While most patients want to know their diagnosis, they differ greatly in how much detail they want regarding self administration and decision making involvement. Research highlights clear demographic trends like women generally want more information than men. Younger adults seek more involvement than older adults. And individuals from urban background tends to desire more detail than those of the urban, than those of the rural people. So here, demographic communication trends related to the gender, age, and urban and rural we have discussed now. From the rural settings. So when the practitioner correctly judges and provides the preferred level of participation, patients show better adjustment and satisfaction. So conversely, a mismatch such as doctor refusing to share authority with a patient who wants to be active result in increasing patient stress during procedures and a high likelihood that the patient will ignore and medical advice or switch doctors entirely. So psychological outcomes of effective communication. Next point. From the psychological perspective, the nature of the interaction is just as important as the medical treatment itself. Studies in health psychology measures success not just by the time spent together, but by the level of patient satisfaction and the accuracy of the information the patient actually recalls. It has been found that patients who take an active role in their treatment tend to recover faster and adjust better during their recovery period compared to those who prefer to passive, inactive role. Therefore, the practitioner ability to foster an environment where the patient feels heard and involved in a crucial component of the healing process. Factors affecting the quality of patient-practitioner communication. So the collaborative nature of communication So the collaborative nature of communication should be a fundamental concept in health psychology is that it takes two to tango, meaning the quality of medical interaction is not determined by the doctor alone, while much focus is placed on the practitioner beside manner. The patient own behavior and communication style play a crucial role in the relationship success. When the patient style is incompatible with the practitioner, or if the patient displays behavior that the doctor finds unsettling, the therapeutic bond can weaken. This breakdown is significant because it directly impacts the quality of medical care and patient receivers. Specific patient behavior that impact care. That is, patients who do not follow the treatment plan previously prescribed and delayed reporting and waiting too long after symptoms appear before finally contacting a healthcare providers. And uncertainty demands are like insisting on specific laboratory tests and medications or medical procedures that the physician deems medically unnecessary. So, Dishonesty in documentation is also a point. Requesting that the doctor certify a condition such as disability, which the physician believes to be untrue. Inappropriate conduct is also a point in this. Making sexually suggestive remarks or engaging in appropriate behavior towards the physician. And the consequences of style mismatching are like when these behaviors occur, they often lead to loss of rapport, which can make the practitioner less responsive or the patient more defensive. In the technical terms, it is important to highlight that the ideal communication occurs when both parties are mindful of their roles. If the patient acts in a way that creates friction, and the practitioner may become more doctor-centered or hurried, which in turn reduces the patient satisfaction and likelihood of following future medical advice. Understanding these factors help both practitioner and patient realize that mutual respect and clear behavioral boundaries are essential for effective healing. And this is the effect of poor patient-practitioner communication. That is a non-adherence rate. This slide shows the percentages. The link between dissatisfaction and health. Poor communication is far from a trivial issue. It is directly impacts a patient health outcomes and their future relationships with the medical system. When patients are dissatisfied with their interaction, they become significantly less inclined to follow medical recommendations or utilize professional services in the future. Instead of seeking advice-based care, dissatisfied individuals may turn to alternative services that prioritize emotional satisfaction over medical efficacy. Furthermore, poor rapport makes it less likely that the patient will attend periodic checkups and make likely that they will switch doctors or file formal malpractitioner complaints. So, defining adherence and non-adherence is like in health psychology, the term adherence and compliance describes the act of following medical advice. However, professionals prefer the term adherence because it implies a collaborative seeking to a plan, whereas compliance suggests a passive patient simply giving in to the authority figure when the patient fails to adopt the recommended treatment or behaviors. So it is termed as non-adherence. That means this is a widespread problem. Estimates of non-adherence ranges from 15% to as high as 93%, with an average rate of about 26% across all treatment regimens. And patterns and factors of non-adherence, which include adherence rates vary dramatically depending upon the type of medical request. For instance, about 1/3 of patients fail to finish short-term antibiotic regimens, and over 80% fail to follow lifestyle recommendations like stop smoking or following a restrictive diet. And interestingly, adherence is typically highest for life-threatening or painful conditions like HIV, cancer, and arthritis, while it is poorest among patients with pulmonary diseases or diabetes. And the rational non-adherence and cognitive barriers are like, it is common misconception that non-adherence is always due to forgetfulness or bad behavior. Often, patients engage in rational non-adherence where they make a deliberate, reasoned decision to stop treatment. This occurs if the patient believes the medication isn't helping and finds the side effects intolerable or cannot afford the cost. Additionally, cognitive and emotional barriers play a major role. Patients may be too confused by complex instructions given during a stressful visit to remember what to do, or they may suffer from depression, while which is strongly linked to a low adherence levels. Understanding these is essential for any practitioner looking to improve the effectiveness of their treatment plans. And these are the improving patient practitioner communication. That is training the practitioner for success. So improving communication is often begins with the practitioner, as many failures in medical settings stem from the violation of simple rules of courtesy. We emphasize that doctors can be trained to foster a supportive atmosphere through both verbal and non-verbal cues. Simple behavior such as greeting the patient by name and explaining the purpose of the procedure while it is happening, and maintaining direct eye contact and with a forward lean and can create an environment of warmth and support with the patient. And to improve adherence, especially practitioners are encouraged to use explicit categorization, dividing information clearly into cues and treatment and prognosis, and to keep instructions as specific, concrete, and simple as possible. And furthermore, a patient-centered approach involves finding out the patient's specific worries and expectations, rather than just gathering objective medical data. Empowering the patient is like effective communication is also a skill that can be taught to patient to help them elicit better information from their physicians. Research shows that when patients are instructed to listen 3 specific questions before their visit, they ask more questions, feel a great sense of personal control, and experience less anxiety. And another successful intervention involves having the patient explicitly promise to comply with the regimen, which has been shown a significantly increased follow through, especially in pediatric care. For long-term treatments, practitioners can use motivational interviewing to help patients identify the personal benefits of adherence and reduce their internal resistance to lifestyle changes. And behavioral method of adherence, which include to bring the gap between doctor's advice and the patient daily life. Several behavioral methods are utilized to enhance motivation. This includes tailoring the regimen, designing treatment activities to the compatible with the patient existing habits, and such as taking a pill during breakfast rather than in the middle of the day. and providing prompts and reminders like using phone calls and notes posted at home or innovative drug packaging with built-in alarms to serve as cues for action. And self-monitoring also we can use, like having the patient keep a written record of their activities such as food diary uh, to increase accountability. And behavioral contracting, like negotiating a written agreement between the practitioner, patient, and family that specifies clear goals and rewards for succeeding. So, by involving the patient actively in the design of these strategies, the practitioner transforms the medical experience from a top down directive into a collaborative partnership. So, by this, we have covered Unit 10, that is patient practitioner communication. And now we are moving to the Unit 11. Okay, that is health compromising and enhancing behavior. So, in the study, this focuses on how individuals' actions and internal beliefs dictate one's health history, one's health trajectory, and dual nature of health behavior. These are the learning outcomes, these are the learning objectives. Then, introduction to health habits, which includes in the study of health psychology, lifestyle choices are characterized into two primary groups, that is health compromising and health enhancing behavior. These choices are not merely habit but act as significant stressors or buffers that influence both long-term physical health and mental well-being. So health compromising behaviors are those that act as stressors and can lead to chronic illnesses. These include poor nutrition, sedentary lifestyles, and substance use. For example, a diet high in processed food combined with a lack of movement acts as a constant physiological stressors on the body and increases the risk of metabolic and cardiovascular issue over time, and strengthening resilience through enhancing behavior. This is most important. On the opposite side of the spectrum, health enhancing behavior function as crucial buffers that strengthen an individual resilience. These behaviors, such as mindfulness, structured physical activity, seeking social support, and promote psychological adaptation and protect against the negative effect of the stress. A student who practices mindfulness, or instance, it is better equipped to coping mechanisms. Teaching these concepts emphasize that these behavior are often a result of individual actions and internal beliefs, meaning that an individual has a power to dictate their own health trajectory by shifting from compromising habits towards enhancing ones. And next point, we are moving to determinants of health-related behaviors. That is focusing on why individuals choose certain lifestyles and how these choices are formed. The multidimensional nature of health choices. It is essential to highlight that health-related behaviors are not formed in the vacuum. Rather than they are the result of complex interplay between personal, social, and environmental factors. These determinants explain why one person may easily adopt a health enhancing behavior like regular exercise, while another struggles to break the health comprising habits such as smoking. By understanding these factors, we can better design interventions to promote long term well being. And the key determinants of health behavior, which includes these factors that influence our health choices, can be categorized into several distinct areas, are like social influence, means peer pressure, family habits, and cultural norms play a massive role in shaping behavior, especially during adolescence period. And personal goals and values, which means if an individual prioritizes long-term health over immediate gratification, they are more likely to engage in enhancing behaviors. And perceived symptoms are like often a person only changes their behavior when they perceive the threat, such as experiencing wake up call through physical symptoms. And access to resources means the availability of health food, safe spaces for exercise, and affordable healthcare are structural determinants that can either facilitate or hinder health choices. And cognitive factors are like this includes a person's self efficacy. Self efficacy means here the belief in oneself that he or she can do any task according to the situation. That is a self efficacy. Internal belief that they actually have the power to change their habits and maintain their change over time is a self efficacy. And the role of internal beliefs is that a critical aspect of this section is the emphasis on internal belief and psychological adaptation. When external resources are available, an individual internal state, such as their level of stress or belief in the benefits of the behavior, dictates whether they will follow through. For example, we can take a person may know that the restrictive diet is beneficial, but they lack the social support or the emotional resilience to manage the stress of that change. They are likely to return to compromising behavior. Therefore, teaching health promotions requires addressing both the external environment and the internal psychological landscape of the individual is very essential. And health compromising behavior, which include nature of health compromising behavior, are defined as habitual actions that act as a physiological and psychological stressors. These behaviors often provide immediate gratification or temporary relief from stress, but lead to cumulative damage over time and eventually contributing to chronic illnesses and reduce life expectancy. Understanding these behavior is crucial because they are often preventable and are deeply rooted in the individual social environment and internal coping mechanisms. And the key examples we can take, like compromising behavior, several specific behaviors are identified as major contributors to declining health, like poor nutritional habits. Alcohol is there, smoking is there, and substance abuse is there, and 5 pillars of nutrition. like consuming diet high in processed sugars, saturated fats, and sodium while lacking essential nutrients. This acts as a metabolic stressors that can lead to obesity and cardiovascular diseases. So sedentary lifestyle are like a lack of regular physical activity, which weakens the body cardiovascular and musculoskeletal system. And this inactivity reduces the body ability to adapt to physical stresses. And substance use and abuse are like the regular consumption of tobacco, alcohol, or other drugs. These substances interfere with neurological functions and damage vital organs, and serving as a primary source of chronic health problems. And inadequate sleep is also a problem. Chronic sleep deprivation, which impairs cognitive function, emotional regulation, and body immune response. So, the psychological style of compromise is a significant aspect of this section is vicious circle. That is, these behaviors create often individual engage in health compromising behaviors as a maladaptive way to adapt to cope with an existing stresses. For instance, a person experiencing high workplace stress might turn to smoking or overeating for themselves. They eventually lower the individual's overall resilience and making them less capable of handling future stresses. And this highlights the needs for health promotion strategies that replace these compromising habits with enhancing ones, and such as mindfulness or structured exercise, or to take a break the cycle and improve psychological adaptation. And health enhancing behaviors, which include health enhancing behaviors, are defined as intentional actions that improve a person's long-term well-being and strengthen their ability to manage life pressures. Unlike compromising behaviors, which acts as stressors, enhancing behavior functions as resilience buffers, and they promote successful psychological adaptation, meaning that individuals who practice these behaviors are better equipped to handle stress without falling into chronic illnesses or emotional burnout. By shifting from habitual reactions to conscious health choices, an individual takes an active control over their health trajectory. So, the categories of enhancing behavior enhancing behavior, which includes several specific practices, are identified as fundamental to maintaining a high quality of life and increase lifestyle. So, which includes physical activity and exercise. Regular movement strengthens the cardiovascular and musculoskeletal system, providing a physical buffer against the biological effect of stress. And mindfulness yoga also can, the patient can practice. These practices are highlighted as powerful tools for enhancing mental well-being. They help individuals manage stress by improving emotional regulations and fostering a sense of internal calm. And the nutritional balance is also very essential. Choosing nutritional dense foods support the body metabolic health, ensuring that the brain and body have the necessary fuel to function optimally. And seeking social support is also very good point. We have to discuss this. Actively engaging with friends, families, or support groups provides emotional comfort and instrumental help to the patient, which are vital for recovery and long-term health. And effective sleep hygiene is also very essential. And prioritizing consistent and restful sleep allows the body to repair itself and engages cognitive clarity for daily tasks. And these are the levels of prevention, which includes primary, secondary, and tertiary preventions. Just now we have discussed behavioral influence, environmental measures, and preventive efforts. Then, coming to the summary, health enhancing behaviors are often the direct results of the individual internal beliefs and self efficacy. And when a person believes that their actions, such as practicing yoga or improving their diet, will truly lead to better outcomes, they are more likely to sustain these habits. This internal shifts is the essence of the health promotion. It moves the focus away from simply treating illness towards the actively cultivating a lifestyle that prevents diseases and enhances the overall joy and quality of life of the patients. So, coming to the summary, compromising is there, drugs, alcohol, and smoking severely damage physiological functioning and create lifestyle dependency that we have to observe. And enhancing behavior like balancing nutrition, weight monitoring, and adequate sleep are the cornerstone of wellnesses. And prevention also, just not we have discussed primary, secondary, and tertiary prevention is essential to reduce illness burden and increase lifestyle. So by this we have covered unit 11 and now we will move to the unit 12. Okay, students. So we came to the unit 12, that is health promotion. So the objectives of the units, which explains about the health promotion, understanding behavioral and cognitive methods, and explore school, work site, and community programs. So coming to the introduction, health promotion is a process of enabling people to increase control over and to improve their health. It is important to distinguish health promotion from simple medical treatment. While medicine often focuses on curing existing diseases, health promotion focuses on proactive cultivation of health behaviors to prevent illness before it starts. So, this approach provides the knowledge and information necessary for individuals to follow and practice healthy behaviors that ultimately increase both the quality of life and total lifespan of the patient. And by shifting the focus from the hospital to the community, the health promotion empowers individuals to see health as a positive resource for everyday living rather than just the absence of disease. So here health promotion helps people to adapt healthy behaviors and avoid unhealthy ones. And it uses education, awareness, and motivation. So the levels of improvement. school level is there, community level is there, and national level is there. That is the level of implementation of the health promotion and the impact of health behavior, how it is impacting on the health behavior. Ultimately, the goal of health promotion is to widespread adaptation of health enhancing behavior. These behaviors serves as an essential tool for managing stress and protecting against the negative effect of the modern, often sedentary lifestyle. When individuals are equipped with the right information, they can make choices such as maintaining a balanced diet and practicing mindfulness that significantly reduce the risk of chronic conditions of the patient. And therefore, health promotion is not just about giving an advice, it is about creating an environment and the mindset whether the healthy choices become the easy and preferred choice for everyone. So the determinant of health includes, it is a vital to explain that health promotion is not merely about providing information, it is about understanding underlying determinants that leads to behavioral change. These determinants are why, inverted commas, why we are following behind an individual decision to follow health enhancing behavior rather than health compromising ones. For example, why does one person successfully integrate daily yoga into their routine while another avoids it despite knowing the benefits? The answer lies in the combination of internal psychological states and external environmental influences. And the determinants of promotion behavior, which includes several core factors, influence whether an individual will engage in health promotion behavior. The role of professionals, which include health practitioners, identity risk, and psychological design behavior changes interventions. And prevention measures, which include elements of health promotion, which covers good governance, health literacy, and healthy sites and well-being promotion. Education and behavioral approaches, which include the primary strategy in health promotion, is that dissemination of clear, actionable information to bring the knowledge gap between the health experts and the public. So this involves using an academic that simplifies the complex medical data into understandable concepts, helping individuals recognize the difference between the health compromising behavior like the sedentary lifestyles and the health enhancing ones like mindfulness and yoga. Behavioral strategies often include tailoring, where healthy habits are designed to fit into the person existing daily rituals, and providing prompts which serves as cues for healthy actions. And by emphasizing internal beliefs and self-efficacy, these strategies empower individuals to feel that they have the personal center control needed to sustain long-term psychological adaptation to a healthier lifestyle. Cognitive methods, which include changing thinking patterns and improving self-efficacy and beliefs influence behavior. in the context of health promotion, behavioral and cognitive methods play a crucial role in bringing about meaningful and sustained changes in individual health practices. It is important to know the behavioral methods primarily focus on modifying observable actions by encouraging individuals to adapt their healthier lifestyles. People generally do not change their behavior unless they clearly understand the reasons behind such change. So therefore, providing proper knowledge about the health risks and benefits becomes the first step. For example, an individual learns that consuming food high in salt and fat can lead to conditions such as hypertension and cardiovascular diseases. So they began to recognize the consequences of their habits, which increase the likelihood of or behavioral change. And the behavioral interventions include techniques such as motivation, counseling, persuasion, and the influence of social norms, all of which aim to reshape unhealthy habits into positive ones. Demonstration and modeling are also effective strategies, such as teaching and correct method of brushing and flossing teeth, encouraging regular exercise, or setting reminders for drinking water. Reinforcement is another powerful tool in behavioral method. When individuals, especially children, are rewarded for engaging in healthy behavior, such as brushing teeth twice a day, these behaviors are more likely to be repeated and maintained over time. The nature of reinforcement may vary depending on age and individual preferences, ranging from tangible towards like gifts to social reward, like praise and appreciation to the children. So there is a drastical change will be there with these techniques and interventions. And promoting health in schools also is very essential. So schools considered as one of the most powerful and effective settings for developing lifelong healthy behaviors. And the teacher is essential to emphasize to students that early interventions in schools environments can significantly influence both the physical and mental well-being across the lifespan of the students. There is a strong relationship between the education and health. As children who are healthy are more likely to learn effectively and participate actively and achieve better academic outcomes. Schools provide a unique opportunity to reach a large population of children and adolescents during their formative years and making it easier to install positive health habits before unhealthy behaviors are developed. And worksite community-based wellness programs, which include employees' health, improves productivity and includes fitness and stress management. So worksite and community-based wellness programs are essential strategies for reaching population that are otherwise difficult to engage. Particularly adults and large community groups. And as a teacher, it is important to help students to understand how health promotion extends behind schools into early everyday living and working environments. While children can be easily reached through schools and healthcare systems, the adult population spends a significant significant portion of their time at the workplace, making work sites an ideal setting for promoting health and well-being. Organizing today increasingly recognize that the health of the employees directly affects productivity, efficiency, and overall organizational success. Poor health can lead to absenteeism, reduced performance, and increased healthcare costs. Therefore, many companies invest in wellness programs to encourage healthier lifestyles among employees. These programs may include organizing physical activities such as marathons, promoting cycling, providing gym facilities, and encouraging regular exercises. In addition, workplace often conduct workshops and training sessions focusing on stress management too. So, weight control, healthy eating, and prevention of lifestyle related diseases such as hypertension and obesity can be controlled. Community based programs are like large scale interventions. And health camps, vaccinations, and awareness campaigns can be conducted in the community for better health promotions. Community intervention focuses on improving knowledge, promoting hygiene, encouraging preventive behaviors, and creating supportive social environments that facilitate healthy living. Activities such as free health camps, immunization programs, distribution of essential medicines, and awareness campaigns about the dangers of smoking and drinking are common examples of community based health promotions. An important feature of community-based programs is their ability to reach a large number of people simultaneously through methods such as mass media campaign, door-to-door services, and public health initiatives. These interventions are not only provide information but also build a social support system that encourage individuals to adapt and maintain health behaviors. And for instance, when a community collectively practices waste segregation or follows sanitation guidelines, individuals are more likely to conform these to positive behaviors due to social influence. So, community programs often involves restructuring the environment by providing cues, reminders, and reinforcement that promote health, such as clean surroundings, availability of healthcare services, and public policies supporting safety and well-being. So, in conclusion, it is important to emphasize that both worksite and community-based wellness programs are internal to comprehensive health working promotions, while worksite programs focuses on improving the health of the working population through structured organizational support, and community-based programs aims to enhance the health of society as a whole by addressing broader social, environmental, and behavioral factors. Together, these approaches ensure that health promotion is inclusive, accessible, and effective in promoting the quality of life across different sections of the population. So by this, we have covered all the 3 units. That is Unit 10. Unit 10 is the patient practitioner communication, and Unit 11 is about health promoting, health compromising, and health enhancement behavior. And 12th one is about health promotion. So today we have covered all the 3 units. Thank you for patience listening. Thank you.